The government of Tanzania has announced the opening of the tourist sector, which was badly affected by the COVID-19 pandemic. Although it has removed the 4-day mandatory quarantine for those visiting the country, instead it has put in place some protocols to ensure the safety of both locals and tourists. Well, joining me live is Dr. Hamisi Kigwangalla, the Tanzanian Minister for Tourism and Natural Resources. Mr. Minister, thank you very much for talking to us. Your government has been accused of putting the economy before the lives of its citizens. Have you reopened your tourism industry too early?
No, not at all. Actually, Tanzania put health of our citizens as well as visitors to Tanzania at the forefront. And we did this through restricting ourselves to the guidelines that were put forward by the WHO. As you might know, that COVID-19, that is transmitted by the coronavirus, is a new disease. So there wasn't any standard as to what measures that countries would take. So we decided to adhere to the guidelines that were put forward by the WHO, which included the mandatory wearing of face masks in public places, observing physical distancing, and extensive hygienic practices.
Dr. Kigwangalla, if I may just come in here, because you've mentioned the WHO twice now, but the WHO, the Africa CDC, and your neighboring countries have routinely criticized your government's handling of this pandemic.
I don't think so, because we've been working very closely with the WHO at the Ministry of Health, and I think the measures that we put in place are actually in line with whatever standards that were put forward by the WHO, and that's why we managed to control the spread of the coronavirus within our country, and that's why we didn't even reach the estimates that were put forward by the WHO. That,
okay, let me just talk about...
By mid of April, they were talking of us having cases of more than 1,000, which we didn't have. And by the mid of May, they were talking of us having more than 10,000 cases, which we didn't have.
Okay, let me talk about some of the protocols which you say you've put in place. I gather that in Arusha, for instance, you've built a spanking new hospital which is kitted out with measures. Are these measures for your tourists, or are they available to locals who live there and also work in the tourism industry?
We actually have put in place a lot of health facilities in place, including air evacuation facilities. We have 2 companies that provide air evacuation facilities for emergencies in the parks. We also have mobile clinics, more than 8 SUV vehicles that could lift passengers, clients who have signs of COVID to different places. And we've also designated a number of hospitals and health centers in the vast areas of our tourist attractions that we put in place. Now, directly to your question, most of these hospitals are actually open also to the general public, but we've only put in place specified rooms that would cater for tourists alone.
Dr. Hamisi Kigwangalla, the Minister for Tourism and Natural Resources in Tanzania, thank you very much for speaking to us here on Focus on Africa. Thank you.
Thank you. You're most welcome.